Man, you are one pathetic loser.
Blah, 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 blah. See, that's the things that are coming out of your mouth, child. Babbling, insanity, delusions.
I am too smart. I am too smart. I am too smart. I am too smart. SMRT.
Dr. Steve, I hope you're better at prostate screenings than you are at radio screenings, you son of a bitch.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the... Oh, God, your camera's not working. With the weirdo... God dang it. Hang on a second. Well... That's all right. We'll finish it.
Hey, at least you're on.
This is a show for people who never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to a regular medical provider, can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POO-HEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good.
Very good.
Now we can stop there, and let me fix the...
You want to plug it real quick?
Yeah. Let me unplug it here. Plug it back in. I don't know what happened. It was working fine.
That was weird.
Do you have a light?
Bingo.
Yeah, there you go. Okay. So I can just start there.
That's cool.
Fix that. Okay. Are you seeing us?
Yeah. Yeah, we're on. Yeah, we're good.
Okay. I don't know why I can't see it here. Okay. There we are. Okay. All right. Okay. All right, Dr. Scott. Don't forget simplyherbals.net. Simplyherbals.net. Are you still up and running?
No, we found the clue.
Oh, no, really? Oh, no.
Yeah, so skip that part.
Really?
Yeah.
It's done.
Yep.
Why is it done?
I'm leaning towards more simplicity in life.
That was complicated?
Yeah.
Yeah. Okay.
Some of it was, not all of it.
Well, that kind of sucks.
Yeah.
What am I going to do about CBD peppermint nasal spray?
I don't know. I'm maybe working on Plan B.
I mean, we had.
If I come up with some, yeah.
God, we had all these Simply Herbals. Let me see. What was this one?
And those you will try.
That was old Dave Cecil.
Shit, I got to call him.
Dave's going to be in Bristol,
Yep.
Virginia, September 11th at Cascade, if you guys want to come. He's freaking amazing. And he's coming back.
It's part of...
Yeah, it's part of Rhythm and Roots.
Yeah,
yep.
Bristol Rhythm and Roots, yep.
Yep. And,
which is always a good weekend. A lot of fun.
It is.
Got some big names coming this
year.
Yeah,
so he's going to be an alternative to the main stage.
Okay.
Because a lot of people don't want to mess with that.
No, agreed. Totally agreed. And plus, if it's hot outside, it's nice to have.
Yeah.
Or
come in and get a beer. Listen to old Dave Cecil.
Old Dave Cecil. He's the
best. Come see your pals. Bristol, Virginia, September 11th, Cascade Ale House. Dave Cecil's return.
Triumphant return.
Yeah. I'm very excited.
I'm excited about it too.
All right. Okie doke. Let me see. Can you see us moving? Because it's frozen on my screen.
No, yeah, totally. It looks good to mine.
Why is it like that? Okay, I see why. Because I'm a fool.
Because we haven't done this in 6 months.
Yeah. Has it been 6 months?
Pretty close.
Okay.
Yeah, almost 6 months, yeah.
Well, okay, so we should, okay, we'll talk about it at some point.
You gonna
check out, it's Patreon's still going, patreon.com/weirdmedicine.
Okay.
I'm still posting stuff there every week. And that's really the way to get this show. But Scott and I are going to still do stuff. Part of the 6-month delay was the new studio, which has not worked out the way I wanted it to. I'm still trying to figure out how in the hell to do this in that space.
Right on.
I can do TV there. You know, I was doing, I've
your
got
shorts, your video are great.
Cinema quality video camera and a giant green screen and stuff. I was doing stuff for Normal World. Well, hell, they don't exist anymore. And Stu and Dave Do America didn't really fit for me. And I love that. By the way, check them out on Blaze TV or on YouTube. That's my favorite just sort of news commentary show is Stu and Dave Do America. And but, I'm not doing videos for them. So I've got this studio, cinema camera sitting there. And so I throw up videos on our YouTube channel at youtube.com/@weirdmedicine. And, maybe they'll get 100 views.
Yep. But they're excellent. They are excellent.
I had one that got 28,000 views, and it was about distinguishing, convincing people that light beer is not as light as they think it is. It's called the light beer myth. And I wouldn't say it went viral, but for me, that was a pretty good one.
Pretty viral, yeah.
The most viral video that I've got on there is my retina specialist sticking a needle in my eyeball. It got 300,000 views.
And that was, 20-some years ago?
Yeah, it was a long time ago. Yeah. And so I reposted it as a short, and it's got nothing but... I couldn't monetize it at the time because it was a quote-unquote medical procedure. Now it's fine.
Okay.
But now I won't get 300,000 views reposting it. So I've been fiddling around with AI. I've got an AI avatar that really, it looks better than me. I showed it to my wife, and she went, "Oh, you look good." And it's like, it's not me, asshole.
Well, I think that's what somebody on here asked if it was you or an AI. And I'm like, I think this is Dr. Steve. I think.
Well, there's so much AI slop on there that I wanted to do AI that was not slop. So I write the words, but I just don't have to have the studio. I can sit here in my office and write up a script, throw it to the avatar, and it sits there and does it.
Oh, wow.
And it does the B-roll. It picks the videos. Before I would sit in front of the green screen. That would take however long it takes.
I want to know.
I'm old one-take Steve.
Yeah.
And so I would do it in a take, and then I got to sit down, and I got to normalize the video because it uses the Panasonic V-Log for anybody that knows what that's about. And then I got to color correct, and then I have to do the chroma key to lay on the background, and then edit out all the flubs. And then I have to find assets, different videos and stills to illustrate what I'm talking about.
Okay, like if you're talking about a colonoscopy.
You'll show, a picture of or a video of a colonoscopy or whatever. And then I got to put labels on it, and then I got to maybe write music if I want to put music behind it and do all that shit. For a 4-minute video, it takes about 4 hours.
Oh, yeah.
Using my AI avatar, it literally takes 15 minutes.
Isn't that crazy? Well, you know what?
That's 13 minutes writing the script.
Well, we were up here just messing around that one day, and it was like the first of this year, and I thought it'd be fun to have a song to celebrate the new year in the style of John Prine. I typed it in AI.
Oh yeah, 15, the AI music.
15 seconds.
There are a lot of people that are really against this AI thing. Listen, I understand it from an artist standpoint. Particularly like Troy Smith, who does a lot of our artwork. He does a lot of artwork for WATP, and he's doing the pig knuckle, pinochle artwork. Okay. Well, I had AI do it, and it was, it was AI slop, but it did it in like 30 minutes. Hell, he's 6 months into this, So I understand from an artist standpoint, some computer is just generating this shit and kind of making you look bad and taking jobs away from people.
Yep.
But we can fight it, but it's coming.
It is
People
coming.
fought against the automobile, and they fought against the internet, and they fought against automation and stuff. It's coming, and there's nothing we can do about it.
No.
So I'm going to use it for that purpose. The brains behind it is still going to be me. What I don't like is the AI slop where they just say write a 60-minute video on quantum physics, and then it does the whole thing, and it's so repetitive and shitty, and there's no insight into it.
Yeah.
To the AI overlords that are listening, I apologize.
Yeah.
For being critical, but just so far not so good. You still need a human brain behind that for it to be creative. But so mine are all I write them.
Yep.
And then just use that to generate the video. So I don't know.
Incredible, isn't it? Well, and they were talking about that today on the news and the importance of how the AI is really going to help with medicine. In the
It
future.
helps me every day.
Every day, yeah. It's huge.
I had a patient, and I can't talk, because of HIPAA, but that had a very complex set of problems. And I knew I felt like I was kind of missing something diagnostically. And I just kind of threw it into medical AI, and it said, "Oh, it could be this, or that." I was like, "Yes, that's what it is. Fuck yes!" And so I did the test, and that's what it was. So it can be very helpful. It can be bullshit too. If you're sitting at home using ChatGPT to diagnose your problems, there was a guy recently that apparently died because he was using ChatGPT as his primary care. And it will very often affirm what it thinks that you want it to hear. So be very careful with that. I have a bullshit detector where if it sends me something that's wrong, I have enough experience after 35 years of doing medicine to detect when it's telling me something that's idiotic. But the fact that it can help me think outside the box is very helpful. So I don't see how an AI will, although I could be wrong, will ever be able to have that nuanced kind of conversation. See, I mean, part of being a physician particularly is reading the room. You got to know your audience. So there's certain folk that I can talk to a certain way, and particularly if they're from Appalachia, my Appalachian dialect that I grew up with comes back, and they know I'm one of them.
Yep.
When I say, listen, they don't allow no corn squeezins in this hospital, and these little ladies that never touched any, but it tells them I'm one of them.
Yes.
Because
Agreed.
some old Yankee isn't going to know what in the hell corn squeezins
Bunch
are.
of damn Yankees. They know nothing about corn squeezins. Or going over there and picking it up.
Google it if you want to know. I'm not bothering to tell
Hey,
you. But
Mogul 345.
let me finish this.
sorry.
But I don't see an AI being able to read the room that way, and being able to have those nuanced conversations, particularly the ones that I have about end of life or symptom management or who's going to be making decisions for you if something catastrophic happens, and making it not only, I'm not going to say it's fun, but it's people come out of there going, well, that wasn't nearly as bad. It was almost entertaining. I don't see an AI being able to do that.
No, and I think that's the key
doing advanced care planning.
And being in healthcare is to have that human touch.
Yeah, I mean,
it makes a difference.
When you're my age, particularly, I've got a lot of experience behind me, and you can see things. I just, I'll be surprised that an AI is ever able to do that, but we'll see. I've been wrong about everything else so far. So. Okay, what was the thing you were going to say?
No, Mogul 345 was saying that you're correct. He understands now, or she understands now, why the weavers smashed all the looms.
Yes.
Agree.
Yeah.
Yep.
Now, Mogul 345 says, AI has sucked all the joy out of my job, software engineering. so I've done some coding. I put myself through medical school coding on 6502 machine code.
Okay.
And for the Commodore 64 and the Atari 800, and we were doing games and stuff. But I mean, it was machine language. We had to rewrite the operating system at one point for the Commodore 64 because it just wouldn't do what we wanted it to do. And I understand. So I understand a little bit the creativity, but also the drudgery of coding.
Yeah.
And AI, I think if you're using it to write subroutines that you then write the main routine and you're calling the subroutines, I think that could really create some joy in your job, because that's the pain in the ass part. Yeah. The fun part is coming up with the algorithm, and the interrupts, which subroutines am I going to call here and under which conditions am I going to do this? Mm-hmm. You can still write that part, but the subroutines themselves, like calculating what a hallway is going to look like. It's all vector calculus, mm-hmm. When you're standing here as opposed to when you walk 3 feet forward. Mm-hmm. I think AI could write those modules for mm-hmm. you. Mm-hmm. So, Mogul, I hope that you can figure that out, because I think the combination of a human brain and an LLM helping writing code could be really powerful. But maybe we should talk about that sometime. We should have Mogul on, just talk.
Yeah, that would be cool.
Yeah.
Because that's something we don't know a whole lot about. I mean, I don't.
Wow. Elliot Franco wins for the Distance Award in the Philippines. Hey, Elliot, kumusta ka? Mabuti. Malaki susu mo. Mabaho ang kili-kili mo. Okay, anyway, that's not all the Tagalog I know.
What does that mean? You need to take a shit?
No, mabaho ang kili-kili mo means you've got BO.
Oh, okay.
Yeah, kili-kili. It's like under your armpits.
That is funny.
Okay, Joe F479 says, what program are you using that automatically generates the B-roll clips? And that is Heygen, Heygen. That's the one I found that does that so far the best. There will be something else that will be better. I was using Nexus Clips, and I got to be honest with you, it just royally sucks. And then the other one that will take your video and then make B-rolls, that is called Opus Clips, and they have AI Producer. So you just give it a video of you, and then it will take it and it'll put you in the corner and put B-roll and illustrate and stuff like that. So if you look at our YouTube channel, you'll see examples of both. There's the ones that actually have me talking, and it'll take out your flubs and your ums and ahs and all that kind of stuff.
Wow.
And empty spaces, and make you sound reasonably professional, and then it'll make a video out of it. And but that is Opus Clips, AI Producer, and then the other one is Heygen. Those are the two. All right.
Very interesting.
All right. Anything else up there?
Well, we got the old one pun.
Oh, it's one pun.
What
do you do one pun?
An old top. Old top 459.
Oh, good
Old top's back.
Well, there you go. And I saw King of All Diffs in there as well.
I saw King of All Diffs, yes.
Chris Primer sent one Weird Medicine with Dr. Steve gift memberships. Thank you. They're 99 cents, so Myrtle might start doing them again. But anyway, all right. We have a lot of voicemails to get to, so I sent out a tweet. It said, if you've ever, because I thought we might do a last show.
Sure.
I don't think this will be our last show. We'll just do them when we feel like doing them. And don't forget, the Patreon has regular content going to it, and the YouTube channel does as well. And if you want a little more content, do Patreon. It's like $3 a month. If you just want the videos that I make before everybody else gets them, and to be able to support the show, you can just join the YouTube channel for 99 cents.
Great.
All right. All right. You ready?
Yeah, let's do it.
All right. Let's see here. So I sent out a tweet saying, if you've ever been helped by this show, there's a reason why I was not for the first time catching a little bit of hell at work for for online activities. And so I wanted a little bit of buffer so I could say, listen, we've not only helped educate our audience, which at one time was up to 100K people when we were on Sirius XM.
Yeah.
And now it's more like around 15K, but that's still it's respectable. I'm happy with it. And our audience is our audience. I've never tried to go too far beyond that because they understand us. I wanted to have a little bit of backup to say, because I know we've educated, we have saved some lives. I've had people who have emailed me saying every October when you do your annual checking of the testicles, I will get one or two emails saying, "Oh, I found something and I went and it was cancer, and if it hadn't been for you, we never would have known about it, or I would have found out about it too late." So anyway, let's see what we got here. So number one.
Hello, this is Josh Ward calling from Noble Gold. I hope you're doing well today. I just received your request to get some information on gold and silver.
So there you go. That's what we got. No, we did get some other ones. Let's see here. Hang on. All right.
Steve, it is Screw from the Game Tapped Movie Show.
What up, Screw?
Such a delight to hang out with you 2 years in a row in Las Vegas.
Yes, sir.
But my weird medicine story is as follows. I went to a doctor to have them diagnose something that I experienced, and she was unable to do it. And not long after that, I listened to Weird Medicine, and you described my symptoms, the esophageal stricture.
Yes.
There you go.
Needless to say, I never went back to that doctor again, but it's a very unpleasant experience, and it was so funny to have you diagnose something that I couldn't get from a doctor face to face.
That's crazy. I hope you got it taken care of, though, my friend, and thank you for calling with that. Let's see here.
Hey, Steve, I'm Dave. I probably haven't really listened to too many of your podcasts or anything since a while ago.
Don't worry about it.
But
You didn't miss much.
I know you've helped a bunch of people in your time, and thank you for doing that, because I know how much it's helped all of those folks. I appreciate what you do. I appreciate what you have done. Thank you. Even if this doesn't air, I just wanted you to know that you are appreciated.
Yeah, thanks
for just even talking about stuff.
Hey, thank you, man. I appreciate it. This is Taylor. You remember Taylor?
Mm-hmm.
He was the drummer for Indie Ghost.
Yeah.
And Indie Ghost had the best rhythm section of any band I've ever seen.
Right.
And I hate that they're not together. They had a bass player named Le Q. His name was Quentin. And the two of them were so tight together. So Taylor, awesome anyway.
Hey, Dr. Steve.
Hey,
I
buddy.
just saw your tweet about where you got your final show coming up. And this is Taylor, formerly of Indighost.
Oh.
And I just wanted to just call and say how much I've appreciated the show and everything, and especially through the pandemic, which was a tough time for everybody. But you went as far as to reach out with some resources to help me with what I was dealing with at the time. And I very much appreciate that. And I love you, dude. Thank you for being such a huge fan of the band back in the day.
Yeah, it's the greatest.
And I just wish you the best of luck and the best of health to you.
That was thank you, Taylor. And it's reciprocated for sure. That was one of the few bands where I very vividly remember standing up on the picnic table, because this venue had picnic tables in it, standing up on the picnic table screaming MF at as loud as I possibly could.
Made you stay out late? Yes.
So
love it.
All right.
Love it.
Let's see here.
Hello, folks. Hope
they-
everybody's doing well.
Hello,
Hope
Stacy.
the fluid family's staying healthy with everything. Hey, I had dinner the other night with a mutual friend, Mr. Robert Kelly, and he was telling me about, his time in his sauna, how much he loves his sauna, and that there's a study out of Finland about people who have spent 20 minutes in the sauna 4 times a week.
Okay.
And how, after a 20-year study, it's shown to help reduce cardiovascular issues and dementia.
You want to look that study up?
Yeah, are we talking hot water or cold water saunas? Cause
No, it's a hot water
Okay.
sauna.
Okay.
I mean, it was hot sauna.
Okay.
Finland sauna dementia study. See if you can find it, because there could be so many confounding factors.
Oh, yeah.
In Finland, particularly, this could be cultural with a genetic component. Dementia.
Lowered ischemic risk. The QOPIO.
Well, now that makes sense to me.
The QOPIO.
What?
Ischemic heart disease study.
Okay. Yeah. Okay. So they tracked 2,300 middle-aged men in Finland, aged 42 to 60, over a 20-year period. Okay. So it's a nice long study. And going 2 to 3 times a week lowered the risk of dementia by 22%. I do understand this a little bit, I think.
Mm-hmm.
When I was working out all the time, I was in a place that had a hot room, and then they had a pool that was cold.
Mm-hmm.
And I would get in the either the hot tub or the sauna, and then I would jump in the pool, and you could feel your cardiovascular system just contracting when you went in the pool. And it felt so good. You got that sort of dopamine risk. And I wonder if just the dilation, because when you're in a sauna,
it's a vascular dilator.
Right.
Yeah.
It's a vascular dilator. That's exactly right. Your body's trying to give off heat. And so the vessels dilate, increasing the surface area. Yeah, they relax. Yeah, right. That's good. Yeah, good way to put it. They relax and they increase the surface area exposed to the skin, so you have more heat being transmitted from the core to the outside world. And in the sauna, it hits equilibrium because you can't give off any more heat than you're already getting. So, and then when you either leave there or jump into a pool, then now everything contracts. Trying to retain heat. So, okay, well, here it is. It says this: heat makes your blood vessels expand. This improves blood circulation and heart health, sending more blood to your brain. Heat triggers special proteins in the body that help repair damaged or misfolded proteins. Well, shit. Okay.
Hey.
So the study shows a strong link, but does not prove that it stops dementia. People who take frequent saunas may also live healthier lives overall. So it could just be that.
Sure, and I'd like to take it just one teeny step further. It helps with the fascia and the muscle and everything to relax.
Yeah.
So it makes it easier for you to move.
Yeah.
Makes you a little bit.
Explain what fascia is, because people think that you're endorsing a certain political.
Oh. No. Fascia is a soft tissue. It's considered an omnidirectional tissue that wraps around everything and really forms everything in the body.
Yeah, silver skin.
Silver skin. And
if you've ever butchered meat, that's basically fascia.
Yeah, or when you open up the package of chicken breast from the grocery store and you look and there's 3 chicken breasts and they're kind of a silver lining. The fascia is the lining that's on top of that.
Yep.
But we have it around everything. It's around blood vessels. It's around bones. It's around muscles. It's around everything. But the greatest density of that fascia is in your lower back, the lumbothoracal fascia. And it looks like a big diamond in your back, and you can look at an image on Google. And but that's, if you want to know what fascia feels like when you first wake up in the morning, you're stiff.
Yeah.
And you can't move very well. It's because all that fascia is matted together.
Interesting.
And what a lot of research has shown, and then when you get up and you start moving, you start tearing it a little bit, and you create this little stuff called hyaluronic acid, which is a lubricant.
Yeah.
Then you start to feel a little better.
It's also the same stuff that's in lip filler.
Yeah, lip filler. And what that does, so you start moving, and everything starts to feel a little bit better as you're walking down the hallway to to get your coffee or whatever. And what a lot of research has shown is that applying heat to fascia specifically increases blood flow and just releases, helps turn it loose. So it's kind of cool.
Well, it's good for you.
Good for you.
All right. Let's take another call.
Yeah.
Hey, Dr. Steve, it's Josh Ward over here at Noble Gold.
Okay. All right. Let's see.
Dr. Steve, I'm watching this show, and they are talking about doing a test to check if somebody is brain dead.
Okay.
and the guy's on a ventilator.
Yep.
They think he's brain dead.
Yep.
They're going to take him off the ventilator.
Yep.
Or stop the ventilator giving him breath.
Yeah.
And C, they're going to keep it off for 10 minutes and see how much carbon dioxide comes back in his blood.
Yes. This is
so apparently if he has a lot of carbon dioxide in his blood, it means his brain is not telling his body to breathe.
No.
And
That's not exactly it, but you've got the gist of it. I'll explain it.
so it's saying that on the most functional level, or the least functional level, your brain isn't working. It's not telling you. The very thing it should be doing is telling you to breathe, and it's not. So it pretty much confirms you're brain dead. Why did I always think that when they did the test, see if you're brain dead or not? Like I go back to that Skyboat chick, where some people thought she would come out, and some people thought she wouldn't.
Well, yeah.
But this seems pretty fucking definite.
Right. Okay. So big difference between Terry Schiavo and brain death. So let me tell you the story of Terry Schiavo. She was 27. She had a stroke. I don't know why. I don't remember what the reason for it was, but she had a stroke and she was in a thing called a persistent vegetative state. So she was able to breathe on her own, and a persistent vegetative state is basically a coma with a sleep-wake cycle. Okay. So her eyes might be open and stuff, but she was unresponsive, and her husband kept her alive for 2 years using tube feedings. And after 2 years, he said, I don't think Terry'd want to live this way.
Okay.
And his reasoning, I believe, was that for thousands and thousands and thousands of years, the way that we left this world was we took to our bed and stopped eating and drinking. And so he wanted to remove the tube and let her die naturally in hospice. And her parents disagreed, so they went to court to stop him. He went to court, they let him do it, and then he actually removed the tube. If I remember correctly, the parents went to court, and the judge forced him to put it back in.
Oh, gee.
And now we're off to the races, back and forth, back and forth, back and forth. And none of these court cases took 5 minutes. Some of them took years. Yeah. And the Supreme Court refused to hear the case because they'd already pretty much decided it in the past. And Congress passed a meaningless resolution, and now the usual suspects, MSNBC, Fox News, CNN, they all get involved. Mm-hmm. And 24-hour news cycle. This went on for 14 years. Now, if you would like to avoid this happening to you, let me tell you what would have solved this problem is an advanced care plan. Terry Schiavo, if she had had an advanced care plan, we never would have heard of her, because an advanced care plan is a document where you say, if I'm in a persistent vegetative state and I don't want tube feed, or you can say whatever, I want tube feedings to go on forever, or I don't want tube feedings to go on forever. I only want them to go on for 2 weeks and then you can pull it, or I don't want it at all under that circumstance. And if she had had that document, we never would have heard of her, because it would have said, yeah, I want it, or no, I don't. The answer to all of these problems is advanced care planning. And when you're 27, that's the last thing you're thinking about.
Sure.
But my medical students and residents, when they come through, they all get advanced care plans because we're doing them on everyone. My office seems to be the only ones who care about it. When I go to the hospital and see somebody, if they have an advanced care plan on their chart, it's because I fucking did it.
Right. I believe it.
There are a couple of my former residents that are doing them, but other than that, and it really, okay, let me tell you a story. This is fictional, but true enough. In the state of Virginia, if you have an 80-year-old gentleman on the ventilator with sepsis, and he's got stage 4 prostate cancer, and now they've turned the ventilator off, or not, I'm sorry, they've turned sedation off, and he's completely unresponsive, so he's comatose. We'll get back to the brain death thing in a second. But he's in a coma. He's never going to wake up. And stage 4 prostate cancer, his sternum, his breastbone is like balsa wood because he's got tumors in it. Yeah. So if we do chest compressions, all it's going to do is just break him. Yeah. So normally you would go to the family and they would make the decision, well, we need to transition to a more comfort-focused approach to care and remove the ventilator, make the patient comfortable, let them die naturally, right? Well, in this case, the decision maker is his beloved daughter-in-law. And his beloved daughter-in-law has been taking care of him for the last 10 years, ever since her husband, who was the patient's son, died.
Okay.
She brings him his meals. She takes him to the doctor's appointment. She has been in the hospital every day with him since he's been in the hospital. That beloved daughter-in-law in the state of Virginia, and that's not the only state, but let's just use Virginia right now. That beloved daughter-in-law cannot make the decision, not only not to withdraw the ventilator and transition him to comfort care, which is something that this guy maybe said he wanted.
Okay.
But she can't even make him DNR.
Oh, geez.
Because only a family member or someone designated in an advanced care plan can make the decision to withdraw life-sustaining treatment in the state of Virginia and other states that are like that. So now what do you do? You can't do anything. Yeah. So legally. So that problem, again, would have been solved. Remember, I told you that she brought him to his doctor's appointments. He's been to the doctor 100 times in the last 10 years. Yep. And the primary care provider not once decided to bring up, hey, you know what? If you want your daughter-in-law to be your decision maker, how about we do an advanced care plan? Or at the minimum, do a medical power of attorney.
Sure.
A medical power of attorney is just where you have a document that says, this is the person I want to make decisions for me. They can make any decision I would make if I'm unable to. And you get two people to co-sign it. Yep. Wow. The crazy thing is, in the state of Virginia, if I'm a notary, if I notarize it, their signature, it's no good in Virginia. But if I get two crackheads literally cooking meth in my parking lot and have them come in and co-sign, totally fine. But anyway, but that makes it easy. So they make it easy to do that.
Sure.
But nobody's doing them.
Oh, my gosh.
The answer to all these medical decision-making issues at end of life is advanced care planning. And if you are 50 years old and you have any medical problems whatsoever and you're seeing your primary care, bring up advanced care plan. You do it. Tell them, I want an advanced care plan. And if they go, then educate them.
Yeah.
They can figure it out. And if you have an attorney do it, I'm going to tell you, that's like going to Lane Bryant to get tires.
Oh, my. Yeah. I hear you.
Okay.
I hear you.
Or IHOP to get, escargot.
Escargot. Oh, my.
So don't do that. Okay? It needs to be a medical power of attorney is a medical document. Now, if you just want to do nothing but the medical power of attorney, then that's okay to do that with an attorney. So no flies on the attorneys. But when it comes to a true medical advanced care plan that says, has scenarios if I'm in a permanent coma or permanently confused or permanently dependent, these are the medical procedures I want and those that I don't want. That really is not what the attorneys do.
No.
They do a living will, and any attorneys out there that do something different, God bless you, but I'm right about this. They'll print out a thing that says if two of my doctors say that I'm in a terminal condition, continuing life-sustaining treatment would merely serve to prolong the dying process, then I authorize the withholding or withdrawing of life-sustaining treatment. When does that kick in, Dr. Scott?
Gosh.
It kicks in when you're actively dying because it already says that doing this is going to prolong the dying process. Well, you're already in the dying process.
Yep.
So it's kind of a little bit too little too late.
Yeah.
It's better than nothing.
Better than nothing, but yeah. Getting it in
but
writing,
do a true medical advanced care plan. Anybody that wants one, just email me. I'll send you one. You can take it to your doctor and get it filled out.
Yes.
Jesus. So anyway, back to the brain death thing.
Okay.
What he's talking about is a thing called an apnea test. So if you have someone that is on the ventilator, their heart is beating, but they have lost brainstem function. In other words, you turn off, like this guy I was talking about that was on the ventilator, where you turn the sedation off and they're not responding.
Gotcha.
So they have no brainstem function. You have to do them all. You got to pull their eye, you got to open their eyes and take a little thread from a Q-tip and rub it across the cornea, and they don't blink. And then you take and then you take the tube that's in the ventilator tube to suction them out, and you push that down into their throat, and they don't cough or gag.
Okay.
and you put cold water in their ear, and there's no nystagmus. You know, if you roll somebody over, put cold water in their ear, their eyes will shake. You know, stuff like that. You have to do all the brainstem functions. And now to prove that they are, so you suspect they're brain dead. Now you got to show that there's a complete absence of brainstem function. What's the most primal instinct?
Breathing.
Breathing.
Yeah.
Thank you, Dr. Scott.
Give thyself a bell.
So breathing. So what you do is you do this thing called the apnea test. So you turn the oxygen up on the ventilator and really hyperoxygenate them for about 10 minutes.
Okay.
And then you turn off, you take a blood gas
Okay.
and you measure the carbon dioxide in the blood. Okay. And carbon dioxide is an indicator of metabolism because we breathe in oxygen, we breathe out carbon dioxide. That's very simple, but it's mostly true. So because we are building up carbon dioxide in our bloodstream, so to equilibrate it, we breathe it out. So if you're not breathing, it's going to build up in your bloodstream, right? So you do a blood gas. It's an arterial stick, and it looks at oxygen and carbon dioxide and stuff like that. Okay, now, and pH. Now you turn off the ventilator, and this is the longest 10 minutes that you'll ever spend in medicine. You turn off the ventilator, you take a little oxygen cannula and put it in down the endotracheal tube to just fill up the lungs with ambient oxygen. And then you watch the patient. Is there any effort to breathe? So, and then so what I have people do, because 10 minutes is a long time to sit there and watch someone that's not breathing, but they're still alive, right? Or, well, there's metabolism still going on. So what I have everybody do is once a minute we do vital signs. That keeps everybody, and then you take a log of it. You watch the ventilator, and you watch the monitor. If they become unstable, you have to stop the test, but they rarely become unstable. It's amazing how the body can function when you hyperoxygenate it like that. So you watch 1 minute, 2 minutes, all the way to 10 minutes. And at the end of 10 minutes, you get a blood gas and you restart the ventilator. Now, if the carbon dioxide goes up a certain level, it doesn't matter. It has to go up a certain amount. And there's no respirations, then that's a positive test for lack of brainstem function. And it highly implies brain death. But just the one test by itself isn't sufficient. To do this, according to the American Academy of Neurology, you need to do another test to confirm that it's permanent. That could be another apnea test in 24 hours, or you could do a cerebral blood flow test where you see if there's blood flow going to the brain. If there isn't, and there's a positive apnea test, the patient is deceased. And if you do it according to this protocol, you will never have a case where someone wakes up in the morgue, like you have heard before, where people have been declared dead. You have to do it this way. Or you're going to end up with false positive brain death determinations, and people are going to wake up in the morgue going, what the hell's going on?
Where am I?
Right. Okay. But that's what he was watching.
Wow.
All right.
Yeah, interesting.
Questions, comments? It's
Yeah,
a lot.
That's good stuff.
Okay.
It's a lot.
It's
Good
a lot.
stuff.
All right. Let's see here.
Hey, Dr. Steve. This is Jeff in Georgia.
Hey.
Got a question. I'm like one of those people that starts and ends every day in my hot tub.
Okay.
And, it feels great, but when you go into the hot tub store, they have this giant poster claiming you receive like 20 immediate health benefits from soaking in a hot tub.
Yeah.
And that sounds like horse shit. I mean, is there any actual benefit other than it makes me feel good? I'm in my hot tub right now, this very moment, naked, half staff.
Excellent.
Thank you.
It's so hot. Absolutely. There are benefits. And we talked about that. This is just coincidence that we talked about the sauna thing. But muscle relaxation, pain relief, people sleep better.
Yeah.
I need to get one of those. I've been waking up at 5 o'clock every day.
Yeah.
Sometimes I go back to sleep. Sometimes I don't.
It's your prostate. That's your prostate.
It's
time.
not. I don't have to get up to piss. I never get up to piss.
Don't you never?
Never.
God, you're lucky.
It's, never it.
You're one in a million.
I know.
Hot tubs are good. I've
Yeah.
got one. I love it. Love it.
Yeah, stress reduction. I mean, stress reduction's good. And the soaking in the hot tub 90 minutes before bedtime, apparently.
Oh, yeah.
That core temperature drop. It's not the core temperature increase, it's the drop when you come out. That's apparently helps signal to your body that it's time to sleep. And people get lower blood pressure too. Why?
Vasodilation.
Excellent. Very good.
Give thyself a bell.
So yeah, if you have a circular, take a hose, hook it up to a pump, and then hook the other end of the hose up to the input of the pump, and fill the whole thing up and turn it on, and put a pressure gauge on the, in that circuit somewhere. If you run the pump faster, the pressure will go up. If you decrease the caliber of the pipe, the pressure will go up.
Yes.
So conversely, if you increase the pressure of or the caliber of the pipe, the pressure will go down if the volume stays the same, and that's what happens in the body. So yeah, it's good for you.
Yeah.
So it's not horseshit.
Nope.
So enjoy.
Yeah.
Now there are contraindications to going in a hot tub if you already have low blood pressure,
right?
Nitrates and stuff like that. You got to talk to your cardiologist about whether you can go in the hot tub or not. Okay, so let's see here.
I hope you're doing good. Oh, so sorry to hear that. My apologies. Hope Scott's okay, man. Anyway.
Oh.
Kind of.
Okay, I missed the whole. I lost the thread on that. Okay, hang on.
I hope you're doing good.
I'm not doing worth a shit.
Oh, so sorry to hear that. My apologies. Hope Scott's okay, man. Anyway. Got an ethical question for you. I keep getting a text message from a telehealth medical care provider wanting me to send them a list of the meds that I'm on to see if they can help me.
Yeah, don't do that.
That just seems so unethical.
Oh, it is,
to be
dude.
soliciting business.
No,
through a text
absolutely. No, that unsolicited medical care is that's not okay. Do not answer unsolicited text messages about your health care. Don't give them any information whatsoever. Now, if it's your doctor, you'll know, or your PA or your nurse practitioner, you will know that it's them sending you that message, because presumably it'll be scheduled. They can send you results and stuff like that, but requests for information from anyone that you don't know is bullshit, and don't do that. So I hope Stacy didn't do that. Anyway, all right.
No, he didn't.
All right. Hey, Darth Nugs. Hey, KB. Yay. KB, that's me, is KB. She's awesome. Okay. Trash Terrian says, I have an advanced directive, but it's very generic. Can you give me guidance on making it more specific? Yeah, absolutely. Email me. I'll send you a copy of a medical advanced care plan that actually I created. And I created it to answer all of the questions that people have asked me over the years that I have to explain over and over and over again when I'm doing an advanced care plan. And I just made it into a thing that is very self-explanatory. So feel free to email me. I give out my email all the time. It's drsteve202@gmail.com. Or you can go through our website. I believe the contact thing still works there. So. Now, Darth Nug says St. Luke's stays flooding my email and notification. Yes. Now, if you've ever been to a health system, then you signed something that said, you can send me information through my text messages. You can make them stop doing that if you want, but if you have a relationship with them, that's different than an unsolicited one. Darth Nug says, give yourself a bell. Being the same one the Undertaker used is very on brand for Dr. Steve. Yes, thank you. I'm glad you caught that. KB says, I've got a healthy prostate. Yes, I do. I do. It's very functional. Premium says, oh, Steve is doing segments about Chad too. About brain death. We had Chad on our show. He was Remember Chad Zumach? We had him on the show. He wanted to quit comedy, and you talked to him about doing visualization therapy.
Oh, yeah.
Well, he was on the way into a sports bar to watch.
Right. Yeah. He was down in Florida somewhere.
He's a very polarizing character. I find him quite amusing. Okay, Old Top says, I live in an area that's a medical Bermuda Triangle. Dr. Steve and Dr. Scott are the best sources. Oh, no, for medical information that I have. I'm so sorry. And there's Amanda. Yay. Hello.
Yes.
Paperwork matters so much. Let's see what else we got. What else you got? Old Top 459. This is your job, Scott. Dr. Steve and Dr. Scott have helped me tremendously over the years by answering my questions, providing information and advice with both conventional and holistic medicine. I don't know about the holistic part.
There you go. There you go.
Well, you don't do holistic medicine. You do traditional Chinese medicine.
Well, I do holistic.
You consider that holistic?
Yeah, I think so, yeah.
Well, I teach people we need to have a holistic approach to our patients, meaning you got to look at the whole patient.
No, I did, yeah.
And the best way to look at the whole patient is do home visits. So any of you budding physicians out there, do home visits, because when you see patients against your background, the background in your office, that's one thing. But when you see them against their own background, in their environment, yes, it really can change things. It can answer a lot of questions, too.
No, I say mine's holistic because if I think somebody needs an EKG or an antibiotic or a surgery, I send them immediately.
Well, sure.
Yeah.
Well, that's complementary medicine. Yeah. It just depends on your definition of holistic medicine. But yes, I think if you're saying looking at the whole patient, then
totally.
that's what we advocate. That I am reposting all of the early Weird Medicine stuff at Patreon.com. And I was thinking about not posting the COVID ones just because, God, who wants to listen to that shit again? But I think just for historical purposes, I'm going to, because I had a lot of evolution in my opinions about things over time. And this business with taking the fifth, when you're talking about, a pandemic that killed however many millions of people across the world, that's some bullshit right there. So I think that kind of caps off the whole thing. And a lot of people were vindicated who said a lot of things back in the time. And we got our show. This is when you were off the show, and Tacey was my co-host. We had a content strike just because I happened to mention the I word that they were doing research on clinicaltrials.gov. With regard to COVID and stuff. So, so we got hit with that as well. So anyway, yeah, it was something, I tell you. So I think I will post all of those. They're coming. They're coming real soon. I just recently posted the one where GVAC passed away, and that was traumatic. I couldn't even listen to it. So anyway, all right. God bless GVAC. We miss him every day. All right, everybody. Check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. And we'll see you in, I don't know, soon for the next edition of Weird Medicine. Hopefully sooner than what we've been doing. All right. Take care. Thank you for your patience.